The respiratory virus known as RSV has been skyrocketing amongst children. Hospitals, especially those dealing with children, are overwhelmed by this right now as cases increase. Add that to the flu and COVID concerns, and medical experts are concerned about what they're calling is possibly a tripledemic. For more on this, we want to welcome back in Dr. Jeffrey Gold. As you know, he is the chancellor of the University of Nebraska Medical Center, and he joins us live this Sunday morning. Dr. Gold, good to see you. First, let's talk about this situation with the children with this respiratory illness. What is it? Where are they getting it from?
Sure. So RSV stands for respiratory syncytial virus, and it is a virus that we have been dealing with, particularly in young children, for a very, very long time. What makes this year somewhat unusual, Tom, is that it appears to be starting earlier and rising faster, and unfortunately filling hospital beds and taking our kiddos out of school. It's typically transmitted at school-age children, preschool children as well. The very young tend to be more severely impacted by it, tends to result, unfortunately, in hospitalization, an unfortunate percentage of the time. And it is concerning given all of the other challenges that we're facing.
So, you know, we had COVID lockdowns and shutdowns for a long period of time over the last 2.5 years as we head into 2023. How much does the immune system of these children, having been removed from the regular exposures that they would face, play into that? Are kids more susceptible to this because they kind of have been separated a bit over the last couple of years?
You know, that's what people talk about, that our preschools and our K-12 early grades are not only an opportunity to learn reading, writing, and arithmetic, but also to expose our immune systems to a host of different types of infectious agents. It is certainly possible that due to the reduction in, face-to-face learning, the closure of our early childhood centers that have occurred across the nation due to workforce shortages, that our very youngest have had less exposure and therefore are at somewhat higher risk. However, if you look at the numbers, it's pretty clear that the RSV spreads are much more aggressive than we've seen in previous years, and frankly very concerning because they're taxing the resources of our children's hospitals across the country.
So Dr. Gold, I want to widen this out now on the focus. We're talking about this virus that's been affecting children. There are also now fresh concerns about the flu season. What are we seeing there, and how could that factor into the problems we've already been dealing with COVID?
Yeah, Tom, you're exactly right. We are seeing flu rear its head here in the U.S. as we do this time of the year. It appears to be rising faster than we do in a typical year. And, we usually watch what happens in the Southern Hemisphere, particularly in Australia, New Zealand, et cetera, where they have good reporting systems for how fast it rises and how high it goes in terms of the total impact of an annual flu season. And unfortunately, if you look at what happened in that part of the world this year, the predictions for the U.S. are that we're going to have a pretty tough flu season. So we have new variants of COVID. We have the RSV that we just discussed, and now we have all the predictors of a pretty aggressive flu season going forward.
All right, and that brings us to the final part of this. We have new boosters that are available for Omicron-specific needs. We have heard reports, Dr. Gold, that people are not getting out and getting these boosters. What does that signal as we move into this winter season here if people are not getting updated on their boosters?
Well, it signals, frankly, more severe illness due to COVID. It's very clear that these new bivalent boosters, the ones that have capabilities for both the original COVID viruses and now also for the Omicron strains, prevent serious illness, hospitalization, and death. If you look at what's been going on in parts of Europe and in the Far East right now with these new BQ1 and 1.1 strains, the XBB strain that we're seeing in parts of India, these are all Omicron subtypes. We want to really make sure that our country is as immune and as protected from hospitalization as we possibly can, particularly as the weather starts to get colder and, back to school, more indoor events, all of those sort of things. The holidays just around the corner. So, our best advice, of course, is to get those boosters up to date as much as possible.
That's good advice. Dr. Jeffrey Gold is the Chancellor of the University of Nebraska Medical Center. Dr. Gold, always a pleasure to talk to you. We thank you for speaking with us this Sunday morning.